Hello everyone, it's Schematic Med, and today we're going to talk about variceal hemorrhage bleed algorithm. If we suspect variceal hemorrhage, first step is to place two large bore IV catheters. The catheters will help us to do volume resuscitation. We will give IV octreotide and antibiotics. Octreotide is splanchnic vasoconstrictor, which decreases blood flow into the portal system, which will decrease portal pressure and will decrease the bleeding. Mostly the variceal bleeding is from esophagus. That's when we need to do urgent endoscopic therapy. During the endoscopy, we can see that bleeding stopped or continuing bleeding and early rebleeding. If we observe that bleeding stopped, start secondary prophylaxis, which is beta blockers, and we need to wait 1 to 2 weeks and we will do band ligation. If the bleeding is continuing, we will do balloon tamponade, which is temporary measure. After that, we will do TIPS, which is transjugular intrahepatic portosystemic shunt, or we can do shunt surgery, which will decrease the portal pressure. If we observe early rebleeding, we will again repeat endoscopic therapy, and if it shows recurrent hemorrhage, we will do what we did during continued bleeding, which is TIPS or shunt surgery. And lastly, I want to briefly talk about the balloon tamponade. A Sancks-Tacon Blakemore tube is a medical device used to control bleeding from esophageal and gastric varices, typically inserted through the mouth or nose, featuring two balloons, esophageal and gastric, that are inflated to apply pressure and stop bleeding. Thank you, bye.